Hello, my name is Maria and I was diagnosed with neuroendocrine cancer in November 2020. The path to my diagnosis was complicated somewhat because I have the inherited genetic disorder hypermobile Ehlers-Danlos syndrome, which apart from causing joint hypermobility also leads to various gastrointestinal problems such as bloating, vomiting, diarrhea, lack of bowel sounds, sometimes a problem called gastroparesis, where your stomach and your bowel just decide to stop working, and all sorts of other problems that come with the fact that the collagen within my bowel is quite slack. However, early symptoms of what I believe was the neuroendocrine cancer developing began to appear in 2017. And around December of that year, I developed a virus which refused to go away, which exacerbated all of my bowel symptoms. During 2018, 2019, I paid numerous visits to the doctor and a whole series of tests were undertaken, blood tests, scans, colonoscopies. At the end of the day, it was decided that I must have some form of severe irritable bowel syndrome because nothing was found on those tests. However, my vomiting was increasing, and this was being accompanied by flushing and by bloating and sometimes diarrhea and an awful chronic fatigue, which I found was possibly one of the most difficult things to cope with because it caused a level of brain fog, and this made it quite difficult for me to keep up with things when I was working. Having been given the IBS diagnosis, I really felt that there was something much more going on inside of me, and so I decided to do a little bit of my own research and came across a thing called bile acid malabsorption. And having had my gallbladder removed in 2003, I felt that maybe this was something that I was suffering from. I suggested this to my GP, who decided to refer me to a gastroenterologist, and further tests were undertaken. And indeed, I was given the diagnosis of bile acid malabsorption in late 2020. Treatment was commenced, and I had my fingers crossed and really hoped that this would resolve all my symptoms and that life could somehow get back to normal. In November 2020, I developed severe diverticulitis. It came on quite suddenly on a Sunday evening. Things always do seem to come on at weekends when there's no GPs available. And I was subsequently admitted to hospital as an emergency admission, where it was discovered that I had peritonitis because I had a tear in my large bowel. I'd suffered with diverticulosis since my 40s, and I'd had various bouts of diverticulitis during this time, but this was by far and away the most severe attack that I'd had. Whilst I was in hospital, a number of tests were undertaken, and what looked like a mass was discovered in the small bowel. Unbeknown to me, further investigations were carried out whilst I was an inpatient, and on the day before I was due to be discharged, I was informed that I had in fact got neuroendocrine cancer, and I had what looked like a 2.5 centimetre neuroendocrine tumour in the small bowel, almost at the junction where it joins the large bowel. This also involved some lymph nodes, and there was also involvement with the mesentery, which is the blood supply to the bowel. Obviously, I had a lot of questions. Not all of the information I was given on that afternoon sank in at first time. I do remember surgery being informed surgery was an option, but my overriding concern was how did I break this news to my family, which is my father and my daughter, because we were in the middle of COVID restrictions and no visitors were allowed, so they couldn't come into the hospital to see me, and my only option really was to telephone them. I felt awful having to break such awful news over the telephone, but I really needed some support at this point because I was quite shocked and upset and bewildered, as you could imagine. So I did indeed break the news to them over the phone, and I could hear the upset in their voices, and my father particularly concerned because my late mother had died of cancer, and he thought, here we go again. However, when I got back to the ward, I found that the nurses were so supportive. In fact, they were marvellous. They put me in touch with the colorectal nurses who were able to give me further information. They informed me about NC UK, and I did indeed contact the charity upon my discharge from hospital. And the hospital kept me in the loop as well and informed me that there was a drug treatment that they would like to commence with me. And so I then was told I was going to start on this drug called lanreotide. An appointment was made for me in December to have my first injection at hospital given by the nurse in the clinic. I wasn't quite sure what to expect at this point, didn't know how big the injection was likely to be, how painful it was likely to be, what it would involve. But the nurse herself was really good. She calmed me down, she answered all my questions, she informed me about the treatment and why I was having the treatment and what it involved. And when I was ready, she then gave me my first injection. Yeah, I used a very strong word because it was a little bit more painful than I'd anticipated. But then I'm not the kind of person who likes injections in the bottom. I don't mind injections in the arm, I don't mind them in the leg, but I really do object to injections in the bottom. So when she suggested that I could ask a nurse from Healthcare at Home, which is now called Sciences, to come out and teach me how to give my own injections, I jumped at the opportunity. Now, I realise many of you listening or watching this may think, oh, no, I couldn't do that to myself. That's fine. A lot of newly diagnosed patients decide I'd rather go to the hospital and have the nurse there give me the injection, or I'd rather have my injection via my GP practice. There's no right or wrong. It's down to personal preference. It's down to what you feel you want to do. Some people prefer to give their own injections because they want a level of control over this and some control over their treatment. I was one of those people, and having been a nurse, I also felt I was capable of giving myself my own injections, but I know it's not for everyone. So I'd advise you to think long and hard about what you want to do. No one will push you into giving self-injections. Everyone is out there to help you. You do what you need to do, and you do it at your pace. After my first injection, appointments began to come through the post for me for various further tests. January of this year, 2021, turned out to be a very busy month. I had 2 CT scans, both with contrast, one looking at my liver and the other, I believe, was looking at my bowel. Then I had a gallium scan, which is quite normal for this diagnosis because gallium is a radioisotope which is readily taken up by neuroendocrine tumours, and so any tumours anywhere in the body can be spotted by using this scan. I also had some further blood tests, and then we played the waiting game. Mid-February, I received a confirmation of the diagnosis that I indeed had a 2.5 centimetre tumour in the small bowel, but thankfully there was no infiltration into any of my solid organs, i.e. the liver, and there was no sign of it in the pancreas or the spleen, but there was clear lymph node involvement. In fact, when I finally saw my gallium scan results and I saw those lymph nodes, they just looked to me like a small bunch of glowy, bright yellow grapes. And I did sort of have a little joke with my consultant about that at that point. The gallium scan itself is nothing really to be worried about. Basically, you go into hospital as an outpatient. You have a cannula put into your arm, and the gallium is slowly injected in, and then you basically lie in a bed and read a book or a magazine and wait for 35-40 minutes. It's advised that you empty your bladder before the scan if you need to go to the loo, and then you're taken into a room and you lie on a bed very much like a CT scan. The thing with the gallium scan is they ask you to keep perfectly still, and it's always the way that that itch comes at the end of your nose or something when when you're lying in the scanner and you can't move. The scan takes between 20 to 25 minutes. Mine took full 25 minutes. It's not unpleasant. You can't feel anything, there's no pain, you just lay there perfectly still. When it's finished, you're free to go home. I drank plenty over the next 8 to 12 hours to flush the gallium out of my body. And then you wait for the results to come through, which, as I say, mine came through about 2 weeks later in February. Due to my Ehlers-Danlos diagnosis and my previous surgeries, I've had quite a few bowel surgeries, I was deemed to be quite a high risk patient for surgery. And we weren't sure how much leave I would need from work. I was told anything from 3 to 6 months because I was going to undergo 2 operations at the same time. Now, this is not possibly normal for other patients who have been diagnosed with neuroendocrine tumours. In my case, the reason I had the 2 operations was because the large bowel, where I'd had the diverticulitis, was in such a poor state that it was deemed it was best if that was removed. And it was felt that it would be a good idea to do that surgery at the same time as the surgery to remove the tumour in the small bowel. So I was scheduled for surgery, and the date came through for the end of June. And the reason for the wait from February to June was due to COVID again, and the fact that I needed to have both my COVID vaccinations before surgery could take place, which I duly did. I had a long discussion with my surgeon prior to the operations. In fact, I remember the consultation being something like 50 minutes long, which surprised me. He answered all my questions, and we did discuss the various surgical options, i.e. I might wake up with an ileostomy, which would be temporary, which would be a bag for waste products which come from the small bowel, or I could wake up with a colostomy, which is a bag for waste products which come from the large bowel, which would be permanent. At the outside, if I was very lucky and all went well, I could wake up with everything intact and joins would have been made internally, both in the small bowel and in the large bowel. But because the surgeon didn't know what adhesions I had from previous surgeries inside me, and because he didn't know how I would be prior to surgery, he couldn't make any promises that that would be the outcome. So I went into hospital the night before surgery was due, because there was a risk that I could develop carcinoid crisis, which is where you get a lot of flushing, raised heart rate, and a big drop in blood pressure. And to avoid this, I was put on an octreotide drip at least 12 hours before surgery, and this carried on for 48 hours, so 36 hours post-surgery, I remained on the drip. I have to say I didn't get any side effects from being on the drip. I didn't get any flushing during my stay in hospital, no cardiac issues as such. So I was well prepared the night before surgery. Didn't sleep much, obviously, because I was quite worried, but my surgeon did come to see me on the morning of my operation. Once again reassured me that everything was going to be fine and that he would come to see me post-surgery. He did indeed come to see me post-surgery, and I was delighted to wake up and find that actually everything had been joined up internally and I did not indeed have any bags. Recovery from surgery has not been without its issues, and if we're honest, we all know that recovery from any surgery has its ups and downs. For me, the pain has been minimal. Initially, the first couple of weeks, it was painful to move around, and obviously a lot of wind inside because, the bowels have been interfered with. But that soon settled down. And what became more of an issue as the weeks went by was diarrhea, which I began to have no control over. I have played around with my bile acid malabsorption tablets, and I've played around with my diet, and I am beginning to now bring this under control. It took about 9 or 10 weeks for this to start to happen, and there are still days where I have to run to the loo more than I would like to. But on the whole, I feel that my recovery pathway has been pretty smooth. I haven't noticed any particular flushing. I've lost about 1.5 stone in weight, which I put down to the fact that I'd had this surgery, and also the fact that I'm feeling better, I'm exercising slightly more, and I don't seem to feel as hungry as I did. So I'm monitoring that, but I'm feeling pretty good about things at the moment. I would be lying if I said that I'd breezed through the initial diagnosis and surgery. In fact, it's been something of a roller coaster. I've likened the experience of being diagnosed with neuroendocrine cancer to suddenly finding yourself bereaved. There's that shock and disbelief at the beginning, the shock that this has happened to me and the disbelief that this has happened to me. There's almost that sense of, are you sure they're my notes you're reading from? They're my test results, they're not somebody else's. And the shock of, well, cancer is something that happens to other people, isn't it? It doesn't happen to me. And then there's a sadness and an anger. You don't quite know where to direct your anger, or at least I didn't know where to direct my anger. And the sadness for me, if I'm honest, bordered more on sort of depression. There was that sort of cloud that came down over me throughout January and February this year. It's more a sort of a sadness, a depression about the life you feel that you've lost. Plans that I had to carry on working into my 60s, will they now happen? I enjoy what I do. I enjoy my job. Will I have to take early retirement? What will my daughter do if I become very ill? And how will we cope? And how will we cope for money and that sort of thing? Then you've got the sort of the fear and the isolation part. The fear part for me was normally in the middle of the night, the early hours of the morning, when you lie there awake and you've got things going through your head, and you ask yourself, well, has the operation cured the neuroendocrine cancer? And if it hasn't, will I have to remain on the lanreotide treatment for the rest of my life? And how's that going to go? And if that doesn't work, and what happens if the cancer spreads? Where will it spread to? What treatments will I have to have? How is it all going to end up? And I'm not saying any of this to worry you or scare you. I'm just trying to point out that we're all human at the end of the day, and we all think these things, but we seldom voice them because we don't want to appear overly anxious at a doctor's appointment, say, or we don't want to upset our family and our friends. But at the end of the day, we are all human, and we do all think these things, and they do go on inside our head. And it's logical that we're going to be thinking these things and searching for answers. The isolation for me kind of came from the feeling of I was the only person that had been diagnosed with this cancer, because neuroendocrine cancer isn't the most common cancer, and a lot of people don't understand what it is. In fact, some of us patients don't understand exactly what it is. So there's that isolation that you've been diagnosed with something and it's pretty major, and you feel like you're on your own. In fact, for me, around about the January, February time, it began to feel like I was living in a parallel universe where on the outside, everything seemed to be carrying on as normal. Yes, I'd had the operation, I was going for the operation, and yes, I'd started on the lanreotide, but outwardly, I was still working. I was still doing the food shopping. I was still cleaning the house. Nothing outwardly appeared to have changed, but inwardly, it was like there was a before diagnosis and there was an after diagnosis. And I was very much living in the after diagnosis world where this was always at the back of my mind, and this had coloured my world, and this had changed how I felt about myself and changed how I felt about the world in general. Um, I then sort of got to thinking in February time that there must be other people out there who go through life-changing diagnoses at different times in their life. And I thought about people who were diagnosed with things like motor neuron disease, people who'd had perfectly normal, healthy lives up until middle age, and then suddenly find they've been diagnosed with type 2 diabetes, and for the rest of their life will have to watch their diet and maybe have to inject insulin. There are people who've been diagnosed with other cancers. Parkinson's was another illness that I thought about that's life changing. And I thought, well, I bet you at the beginning they felt pretty much the same as we do now. The sense of bewilderment, the sense of wanting to get to grips with things, of trying to take back some control on your life. And then I thought about my late husband, who I haven't mentioned here before. He had a condition called dilated cardiomyopathy, which basically meant that his heart muscle didn't work properly. And in order for the heart to keep working, it grew more and more muscle. So it was getting bigger and bigger inside his chest and basically pushing his lung out of the way, which meant that he was getting breathless a lot and losing a lot of weight. He eventually had a heart transplant 6 weeks after we were married at Papworth Hospital in Cambridge. And I remember thinking back to how we got through that time and how my husband just seemed to deal with all the medical interventions and the whole idea of someone else's heart beating inside his chest with a calmness and a determination and bucket loads of humour. Now, there isn't a lot of humour to be found in cancer for sure, but I do feel that humour is a tool that we can use in our armoury if we can find some. The other possibly underestimated psychological side effect from being diagnosed with any form of cancer or any major illness or disease is the attitude of other people. Initially, there's that decision of who to tell, how much to tell, and whether or not you want to tell everyone. There's no reason why you have to tell everyone. If you just want to tell your nearest and dearest, that's fine. Everybody is different. I'm sure many of us who've had surgery to remove neuroendocrine tumours, particularly in the bowel, have come across people who say, "Oh, bowel cancer was it? Yeah, well, my aunt, my uncle, my granddad, whoever had that, and they had that surgery and they were completely cured. You'll be fine. You know, you get over the surgery and absolutely fine." But actually, it's difficult to explain that the tumour may have decided to form in the bowel if that's the kind of neuroendocrine tumour that you have. But actually it's a neuroendocrine tumour. So it is what it says. It's a tumour of the hormones. It's a hormone cancer, if you want to call it that. And I've had some very peculiar reactions to that one. People saying, "Well, I didn't know you could get cancer of the hormones." "Oh, never heard of that. What's that then?" And some people thinking, "Well, actually, are you making that up?" "Oh, I'm sure you can't. I'm sure you can't get cancer of the hormones. You're just making that one up, you know." And people not realizing that sometimes you can have cancer and the cancer not be curable, but actually you can live with it and you can live a pretty reasonable life. Even, you know, whilst you're undergoing treatment, you still have a quality of life. In terms of employment, um, this is a bit more of a difficult decision, and I wouldn't profess to be able to tell you which way to go with this. I think you have to look at your own situation, what money you have coming in, the level of stress you have with your job, how high powered it is, whether you're full time, part time. Um, for me, it was easier to inform a good and supportive employer. And on the whole, because I have multiple jobs, I work in governance for schools, and I work across a lot of schools, and the majority of my schools were good and supportive. What I didn't expect was one of my schools to not be so supportive. And I discovered that cancer prejudice is still alive and kicking in the workplace, even in this day and age, even with the Disability Discrimination Act and all the other things that are put in place. That shocked me, and it also saddened me. And I got through it, and I made the decision that I didn't need the added stress that was coming from this employer in my life. I certainly didn't need the aggression that I felt I was getting from this employer. And so I made the decision to terminate that employment. Okay, I lost out on some salary there, but on balance, I felt that my own mental health and physical health was worth far more than any money. And I also didn't need the added stress in my life at this point. Currently, I've made the decision to reduce the number of schools that I am working for, and this will reduce my hours to around about half of what they were prior to diagnosis. I am due to return to work sometime in October, and I'm greatly looking forward to it. I don't feel I'm ready to climb on the early retirement wagon just yet, but I'm aware that that is a pathway that I may have to consider probably sooner than I would have anticipated. But the way I feel about employment for myself and learning to live alongside the fatigue that this cancer can cause and the treatment is that if day to day things are doable, then I would like to continue for as long as I can. And if at any point that changes, well, I'll be well informed by my consultants and by my employer as to my rights and what I can expect. And I will work at that when that day comes, and I will make the decision when that day comes. But for me at the moment, I feel that the time that I've been away from work has given me time to reflect, given me time to think long and hard about where I'm headed. And so reducing the number of schools that I'm working for, but continuing to work in a job that I love and a role that gives me a lot of fulfillment is a positive for my mental health. It's a positive for me. And rather than give that up completely at this point in time, I would like to continue. And I think at the end of the day, you can only make the decision that feels right for you and feels right in many respects. You know, if you're in a job you absolutely hate, then it's very difficult. And if you have unsupportive employers, again, that is very, very difficult. And I do sympathise with you. But everybody's situation and circumstances are different. Everyone's neuroendocrine cancer is different, and some of you will be diagnosed at a later stage than I was, and in which case the decisions you need to make are very different to the ones that I'm able to make. So I'm not for 1 minute telling you what to do, and I know that the charity has a lot of information and a lot of help and support out there, which you can access through the website. Where family and friends were concerned for me, it just confirmed my belief that I have a very good family. I have quite a large, wider family, aunts, uncles, cousins, who have been very supportive and have kept in touch and have offered all kinds of help. Friendships were slightly different. I had friends who have had their own cancer battles, and they stepped into my life in a big way, particularly when I was first diagnosed, and have continued to support me throughout this year, which has been a blessing. Other friends that I thought I could come to rely on, that I thought would be there, weren't, which was sad and disappointing, but maybe that's human nature for you. And new friends have been formed. And it's not always the people that I expected would be there that have turned out to be there for me. And I think this is possibly the case at a lot of times when we get to a major crossroads in life, be it a bereavement, be it a cancer diagnosis, major things that happen. And I've seen this when I was a nurse as well. Very often people would receive a terrible diagnosis, and the people that they thought would be there for them suddenly melted away into the background, but other people stepped forward and supported them. And I feel that I have, in a strange way, benefited from this process, because I now feel that I've got a very good set of friends. I know the ones that I can rely on now, and we're open and honest with each other, and I support them through their life stories and problems as much as they support me through mine. And so for me, at the moment, I feel I've kind of been lucky, but I have seen in the past times where that hasn't always been so for people. And as a nurse, I've been left to try and pick up the pieces with a patient. So just expect the unexpected when it comes to friends, I think. You know your friends better than I do. They're not my friends, they're your friends. But just, letting you know that people that I thought I could rely on disappeared, and the ones that was a pleasant surprise unexpectedly came forward and have been a big support to me, and I wouldn't be without them. What has helped over these last 9, 10 months? Well, firstly, NCUK. It's been my lifeline since diagnosis. When I was talking to the nurse in the neuroendocrine clinic, one of the things she warned me about was, please do not Google neuroendocrine cancer, because the way that the algorithm works on these things, the first things that come up obviously are the stories that everyone's clicked on, which tend to be the scary stories. People who have had terrible time with it, people who are at further stages, that's maybe stage 3 or stage 4, people who want to publicise things that have not gone well at hospitals and that sort of thing. Basically, if you do Google anything like that, you'll just end up depressing yourself or terrifying yourself and giving yourself more questions than you've got answers to. So although it's tempting, what I've done is I've tended to stick to the NCUK pages, website pages. And the other good things with NCUK have been the Facebook page, which, there's wonderful support to be had out there by people who are ahead of the game with this, who have been diagnosed a lot longer than we have. And it is, without a doubt, the most supportive Facebook page I think I've ever belonged to in my life. And I'm not a big Facebook fan, but I do highly recommend this page because we are there for each other and the support is palpable. It really is. And the other thing that has supported me as well are the Natter groups. NCUK at the moment is having online Natter groups, and these take place throughout the year across different parts of the country. They are usually region by region, but there is nothing to stop you joining in a Natter. If you live in Scotland, you could still join the London Natter, whatever. It doesn't really matter. You just join in with whatever suits you, at whatever frequency suits you. You're not under obligation to join them, but it's lovely to be able to see and to talk to people who are going through what you're going through. Very often newly diagnosed people as well. And you get to a Natter and you think, well, I was diagnosed last November, and suddenly someone pops up who was diagnosed this July, and you think, oh, I know what that feels like. And it's just nice to be able to meet other patients. We're not yet having face-to-face meetings. COVID's still out there, but even online, it's been a real benefit for me, and I can't thank the charity enough. My GP has been another fount of support. I'm fortunate. I have 2 great GPs that look after me. One of my GPs sometimes pops off to work in the hospital, leaving me in the care of another GP, but both of them are equally as good. I had a bit of a delayed reaction from my diagnosis, and it got to around about March, April, and I just hit rock bottom, I think, for about 3 weeks, which also coincided with my first AstraZeneca vaccination, which knocked me off my feet a bit as well. And so I was signed off work for 3 weeks by my GP, who wanted me to have a complete rest. And enabled me to have two long talks with her, which helped and suggested that I received some counselling or some help from a cancer charity. Fortunately, NC UK stepped in again here, and I was able to start some counselling sessions with Kim, one of the NC UK counsellors. There's no shame in asking for help, and really I wished I'd have done it sooner. Kim has been an immense help, and just being able to have that safe space for 50 minutes to unload and say what you feel must be the most absurd things to someone because you're thinking them but you don't really want to voice them, and to have that person say, do you know what, that's perfectly normal, I know where you're coming from, and here's what we can work on this and we can move forward together, you know, we can do this, we can do that, have you thought of this? And it's, you know, without my GP being there to advise and support, again, that's, you know, another link that's helped me. I know GPs are very busy people. I know not all GP surgeries are back seeing you face to face, and that you sometimes have to resort to online appointments or telephone appointments. But the GP, despite the fact you may be under a specialist centre or your local hospital and you have an oncologist and consultants looking after you, your GP is still very much a gateway for you, and your GP can still open a few doors for you. You know, medications may increase, and it's always good to touch in with the GP and make sure that they're on your repeat prescription form and everything's going okay. So I can't thank my GPs and my GP surgery enough for the support that they've given me during the last 9 months. Family and friends, again, going back to what I said earlier, I can't thank my family enough either, or my friends, for the support that they have shown me. I have a work colleague who has made it her goal in life to send me the funniest gifs that she can find on Snapchat each week. And some weeks those have been a lifeline. I've been waiting for those to come through, and some weeks they're absolutely hilarious, and other weeks they're ones that make me smile. And just having a Snapchat or a text or someone send me something funny via an email each day or every few days has been a lifeline. Now that COVID restrictions have lifted a little bit and I'm doubly vaccinated, just being able to go out for a quick meet with a friend, either outside or socially distanced for a coffee. You know, again, it's little things, but the little things, you know, begin to mean a lot after this sort of diagnosis and the shock that you've been through mentally and physically. It's just nice to bring a little bit of normality back into your life and to be able to keep those contacts up, because you very much need support socially when you're going through something like this, and I would highly recommend it. Hobbies are another thing that I would recommend that you continue with. Whatever absorbs you, whatever takes your mind off things, whatever brings you enjoyment, peace, fulfillment, go for it. Use it. This is the time when you need to fall back on them, really. I had begun to develop a love of gardening. I'm not an expert, but I like to tinker around the edges. Back when I was in my 40s, it tends to run in the family. My mum loved her garden, my grandma loved her garden. And so I've spent a lot of time out in the garden over the spring and the summer, trying out different colour schemes and changing things around a bit. And I get a great deal of satisfaction and an overriding sense of peace when I'm out there with my hands in the soil and totally absorbed, and you know, whole news items can go over my head when I'm out in the garden because I've only got one thought, and that's I'm out here in the fresh air listening to the birds, I'm putting this plant in, I'm pulling that weed up, I'm totally absorbed in what I'm doing. So it's me time and I can switch off. Reading has been my saving grace as well. I've always been an avid reader, and I don't know how many books and novels I've been going through during the last 6 months, but they have certainly helped. Painting, drawing, that sort of thing. I'm very much into art. I've discovered acrylic paints, and that's become my favourite form of art now. And music. I do like my music. I'm a big Classic FM fan, but I listen to all sorts of other music as well. And these have been my releases. And when I've needed a pick me up, it's a cup of tea, and do I do some painting? Do I read a bit more of my book, or do I go out in the garden? And I would really say, whatever hobbies you have, really make use of them at this point, especially being newly diagnosed, because they help to ground you, they help to take your mind off your anxieties. They give you a bit of peace for however long you're at your hobbies. It just gives your brain a break from eternally worrying and thinking about things. And that brings me on to another um, sort of linked thing, individuality, which you may wonder what I mean by that. There are a few people on the NC UK website who've brought this up, and I also echo it. Just remember, with this diagnosis, you are still you at the end of the day. Whatever it was you liked and disliked and did and didn't do, or whatever clothes and fashions you like to wear, or whatever, you're still that same person. You're the same person you were before the diagnosis, and you are still the same person after the diagnosis. We've got different ways of taking on news, accepting things, and we all react differently. And it's good to sit down and just remember that, who you are inside, that person that makes you you. So you might now have a fancy sounding cancer, but I bet you're like me. You're still the person that likes classical music. You're still the person who loves the colour blue. And you're still the person who's never ever going to eat an avocado. I hate them, sorry, but I do. And you're still the person who doesn't like crowds. And that's me. I was like that before I was diagnosed, and I'm still like that now. What I'm trying to say is that there's no need for you to feel that you have to change to fit in with other people's perceptions of what a person like cancer is like. Just remain true to yourself and find your own pathway through this difficult time of being newly diagnosed. There's no right or wrong way. And whilst other people may give you well-meaning and what seems like good advice, you just go with what works for you and what you feel deep down inside you is right for you, and don't lose sight of who you are. That's the most important thing. And I think why I probably got a little bit depressed earlier in the years, because I did just that. I did lose sight of who I was. That's back now. I know who I am, and I know what I like to do, and I know where I'm going, but it does take time, and just be true to who you are. Humour. Back to humour again. Um, Maybe it's because I used to be a nurse, but over the years I've developed a bit of gallows humour. It's a bit black sometimes, and I can find the funny in most things. I must confess it took me a long while to find any humour in being diagnosed with neuroendocrine cancer. But one of the first things I did, which made my family laugh, is when I discovered I'd got a tumour in my bowel, I decided to give it a name. And I think this is common with a few of us. And so I called mine Albert. And so I used to talk to Albert, and I used to tell him he wasn't to get any bigger, and he used to stay where he was, and he wasn't to throw out any little friends anywhere. And then when I got my date of my operation, I served notice on him, and I said, well, you're being evicted in June. And, um, since I've had my operation, I have to say my bowels feel like they belong to someone else. I feel like I've had a transplant of a bowel from another human or even an alien. And so I've taken to calling my bowels my alien insides, which again is making my family laugh. But it's just my way of coping, my way of getting through this. And going back to my friend who likes to send me humorous gifts, the humour doesn't have to be about cancer. The humour could be about anything. And I think it's good if you can find something that makes you smile or makes you laugh every day, because it has been proven that people who smile or laugh more, we tend to be mentally a bit stronger, and our immune systems are meant to be a bit stronger as well. How true that is, I don't know, but it certainly can't do any harm to try and lift yourself up a little bit. Read a funny cartoon in the paper. I mean, I follow Off the Leash, which used to be a set of cartoons, which is now online, and they send a new cartoon to me in my inbox every morning. Okay, it's dog-based humour, and if you're not a dog person, perhaps it's not for you. But it always gives me a smile first thing in the morning, and it's far, far better than looking at the news online, which is only going to depress you. Some practical advice here. Well, the first one is pretty obvious: rest. It's a difficult one to do. We're all accused of not giving ourselves enough time to rest. And I find with this, you need to rest when you need to. You need to listen to what your body's telling you. If your body says, do you know what, I've had enough for today, I need to go and sit down for 5 minutes with the newspaper, or need to go and listen to some music or have a cup of tea, then there's no shame in doing so. Just take that cup of tea, take that drink, whatever, go and sit down and rest, because you'll feel all the better for it in the long run. Try and learn to listen to your body so that you're not getting to the point where you've completely run out of energy for the day and you really can't do anything else other than go and lie on the bed in total exhaustion. I know it's difficult, and I know we also have good days and bad days. Some days I think I want to do A, B, and C, and I probably get A done, and B and C, I'm sorry, I haven't got the energy for you today. Another day, I might think, oh, I can do A, B, and C, and actually I can that day, but that doesn't always apply every single day, and it depends on where I am in the lanreotide cycle, whether I'm coming up to my next injection, whether I've just had an injection, how I'm feeling mood-wise, because don't forget this is a hormonal cancer. There's lots of variables. If you want some advice on things like pacing and the spoon theory, which some of you may have heard of, then there is a company called Stickman Communication, which provide posters and little cards and things which can help you. And I will be bringing up their information in the references at the end. Having talked about rest, I'm now going to talk about exercise. And yeah, I have found, especially post-surgery, there has been benefit in exercise. Even a 5-minute walk a day, just round the block, just to get out of the house, get out of the four walls, change of scene, a bit of fresh air, is enough to give you a boost. It also provides some routine to your day as well. I'm lucky, I've got a little dog and I live in a semi-rural area, so I'm able to go for a couple of short walks each day. Gardening is another form of exercise. You choose the exercise that most suits you, but certainly I found with my post-operative recovery, a little bit of walking each day certainly did wonders for getting things to settle down in my bowel and helping me to sort of, feel more positive about myself. And it's better than just lying around the house, which, let's face it, that doesn't do anybody any good. But again, there's that fine balance between exercise and rest. Pampering. We all like a bit of pampering now and again. So it needn't be anything exotic. Ladies, nice scented bath, or your favourite shower gel, or whatever bath essences you like to put in there, bath bombs, bit of lavender is nice for relaxation. You could splash on your favourite perfume even if you're not going anywhere. I'm sure you have pleasant memories associated with your favourite perfume, makes you feel good about yourself. Guys, you might have a favourite aftershave or body lotion that you like to use or to wear. Ladies, again, you might want to get your nails done or something like that, or get a friend to come round and do them for you. And we all like the biggie, chocolate. If you want to eat that chocolate, as long as it doesn't upset you too much or cause diarrhea, then eat the chocolate. It's not going to do you any harm. If it makes you feel good for 5 minutes, then great, go for it. Do something just for you. As I say, it needn't be expensive. It can be a simple thing, but it's just a self-treat, something that maybe you would have liked someone else to do for you, but they haven't, but you're doing it for you. So if you want to buy yourself a bunch of flowers, do. If you want to paint your nails, do. It all helps, and it certainly helps with your mental health. Again, another thing that helps with mental health is talking, and I should know because I can talk for England. But talk to a trusted friend. Talk to your partner if you've got one. Talk to your GP. Talk to a counsellor. Whoever you feel that you can confide in, please don't bottle those feelings up. It won't help you in the long run. And you might want to talk to different people about different things. You know, you may want to talk to a very close and trusted friend about something that you wouldn't necessarily want to talk to your mum about, say, or you wouldn't want to talk to your GP about. But on the other hand, you might want to talk to your GP or your oncologist about something you wouldn't dream of talking to your best friend about. So, you know, talk, get things out in the open, because then you can make informed decisions. Then you feel better about yourself, and then you're clearing your headspace. Not everyone thinks counselling's for them, so I'm not going to push you down the counselling route. For those of us that do use counselling and find it useful, it's great. But it's down to you again. All of this is individual choice. Notebook. Now, because of COVID and we couldn't take anyone into our consultations with us, what I found useful was to take a small A6 notebook and a pen with me when I went into any consultations. What I used to do was think about questions I might have before the consultation and jot, 2 or 3 of those questions down, the biggies, the ones that were really bothering me. And then I wouldn't forget, because there's nothing worse than coming out of a consultation and thinking, oh, I meant to ask him that. And then you've got to wait however many weeks or months it is before you see them again. The other thing I found useful was to take the notebook with me to jot down anything that I was likely to forget during the consultation. Sometimes you might be able to use a recording app on your phone if you're able to. And then the other thing that I've done as well is all my hospital letters, all my reports, results, all that. I bought an A4 ring binder and I make sure that everything's in there. Even if something is emailed to me from the hospital, I tend to print it off and put it in there. And that way I've got a complete record from start to finish of where I'm at, when I had an appointment, what appointment it was, upcoming appointments as well are in there. Because it's easy with everything going on to lose track of everything. And I know some of you keep a little sort of Perspex pocket A4 with information that you can take into hospital with you, which is a real quick way of informing hospital. I've got neuroendocrine cancer. This is the treatment I'm on. This is what I've had so far. All the bits that when you go into hospital and they're taking your information down, they need to know. And that's another useful thing that you can do. Medication. My advice would be to keep enough medication, be it painkillers, anti-diarrhea medicine, all these sort of over-the-counter medications. Make sure you keep enough in the house, because you know what's going to happen. It's going to be a bank holiday weekend. It's going to be a weekend, and you're going to, suddenly have a bout of diarrhea that you can't treat because you've run out of diarrhea medication, or you've got no pain relief in the house. And then it's 111 or trying to find a pharmacy that's open. So I have peace of mind by having a little Tupperware box where I keep pain relief, abdominal cramp medicine, diarrhea medicine, and I know it's there, and I make sure it's topped up. And then if it should be a middle of the night or a weekend, I've got some medication I can take. And then another useful tip, which I wanted to offer to you, was some of us have been on omeprazole, which is a proton pump inhibitor for heartburn. Some of us may have reflux and been on it for quite some time. And a little hint and tip that I was given, especially for us ladies that go past the menopause, is that obviously long term, this can deplete calcium in your bones. And a way to try and head this off is to take a calcium and magnesium tablet, which you can buy combined with your evening meal. You only need one of these a day, and that is enough to head that off at the pathway whilst being able to remain comfortable on this medication. Delegation. Don't be afraid to ask others for help. I'm afraid, when I was first diagnosed, I wouldn't ask anyone for help. I was still plodding on, Miss Independent me. But there does come a point where you realise, actually, I can't bend over today because I've just had an operation, so I can't reach that thing that's on the floor, or I can't stand long enough to cook the evening meal. Someone else will have to do it, or could someone help me with the washing up? There's no shame in asking for help and delegating tasks amongst the house. And I've accepted help with shopping and cooking when I've needed it, because it gives you more time for your body to recover. Another biggie, comfortable clothing. particularly if you're post-op, whether you're male or female, you really don't want that belt digging in around your middle and those tight jeans on. I found that sort of wearing loose, comfortable clothing was enough, and you just feel so much better for it. The other big thing that I've done early on was invest in what I call a metal-free outfit, because we tend to have to undergo so many investigations. Most times you're going into a CT scanner or sometimes an MRI scanner, no metal. So you strip off, freezing cold room, got your underwear on, they give you a hospital gown, open at the back, and there you are, lying, shivering on a CT scanner bed. And I don't know why, but scanning rooms always seem freezing to me. So to get round this, I have got some jog pants that have no metal in them. I've got various tops. And for ladies, I have found that you can buy bras that have absolutely no metal in them. Lots of yoga bras out there, ladies, and there are some more supportive bras that don't have the clasps at the back, which you just pull on over your head, but they don't have any metal. Hence, you don't need to get undressed, you don't need a hospital gown, and you're a bit warmer when you're lying in that scanner. The other thing I'd also advise where comfortable clothing is concerned is to have at least 2 sizes in your wardrobe. There are times when certain interventions will make you bloat. And there's nothing worse than having clothes that fit you on every other day, but on the day when you want something loose on, you've got nothing in your wardrobe. So I keep a couple of pairs of jeans, a couple of pairs of jog pants that are a size or 2 sizes bigger than I would normally wear, just so that I can put them on the days when I'm feeling a bit uncomfortable. And then when everything's back to normal again, go back to the normal clothes that I always wear. Just another tip. Finally, online shopping. COVID has meant a lot of us turn to online shopping, and obviously with the treatments that we go through, we're all a bit worried that we're more susceptible to picking up COVID when we're out and about. And actually, sometimes we don't want to go out and about, and certainly post-surgery, you don't want to be lifting heavy shopping. So online shopping is really useful, and I found it really useful for me. I've been very lucky. I've used various supermarkets and I've always received help when deliveries arrive. People have been happy to put things a bit higher up on the doorstep, or even now with the restrictions lifted a little, bring some heavier items into the house so I don't have to lift them up. It's just a useful thing, a useful tip that I would like to pass on to you all. Finally, just with this, be prepared to expect the unexpected. None of us know what's around the corner, and it's a funny old cancer, this, really, to get your head round. So it's not one that you would have expected to be diagnosed with in the first place anyway. I bet most of us, if we were thinking we were one of the 1 in 2 that was going to develop cancer, would have thought, well, it would be breast cancer or it would be colon cancer or one of the more common ones. So this is an unexpected diagnosis. It is a strange cancer, and it can affect your hormones, so it can affect your mood. So just go with the flow and expect the unexpected. Again, take each day as it comes. I live each day to the full. I don't worry about tomorrow until I get up tomorrow morning. I certainly don't think about next week, next month, next year. Just take each day at a time. Just savor the day for what it is. Enjoy every experience that floats by. Enjoy being with your family. Enjoy being with your friends. Enjoy what you're doing at this moment. Even if you're feeling really awful, you could play a nice piece of music which you can appreciate. You could read a passage in a book which you could appreciate. So just get the most out of everything that you're doing. Again, what I said earlier, don't be frightened to ask for help from others, and don't be too gracious to not accept it. Trying to keep a positive outlook. I'm not the best at that. I'm not preaching. I'm not telling you what to do, because I'm the world's worst at this, but I do at least try keep a positive outlook. This is a quote that I found, which is in The Secret Garden, and I thought it was quite a nice, apt one to end with. The quote reads, "Surprising things can happen to anyone who, when a disagreeable or discouraged thought comes into his or her mind, or just has the sense to remember in time and push it out by putting in an agreeable, determinedly courageous one, two things cannot be in one place. Where you tend a rose, a thistle cannot grow. And finally, I just thought I'd give you some useful references. So I've given you the websites for bras for ladies. There is a nice little app called Budify, which you can download either from the App Store or Google Play. And it's just some very short meditations, and they really are short. Some of them are 2 or 3 minutes, some of them are 5 minutes. You can listen to them in the car, you could listen to them going to sleep, in a hospital bed, going for a walk. Highly recommended. They're very good. And I found them very useful because they're not long 30, 40-minute meditations. Medical Alert, I decided to purchase a bracelet. And the reason I went for Medical Alert is because you can update all your online information as your treatments change, and should you be away from home, say on holiday, and you're taken into hospital or the emergency services need to get hold of your information quickly, then the number is on your jewellery, and they can have the most up-to-date information because you've updated it yourself. And I just found that to be so useful. Stickman Communications, it's a great website for all things disability related. Have a look around, see what you think. There's some good stuff there, and there's some excellent stuff on pacing. And finally, you've got to the end of this. It's about an hour. I do apologise, it's been so long, but thank you so much for listening. And if anything that I have said has chimed with you or helped you, then I'm so grateful for your time. And I wish you all the best on your neuroendocrine journey. And who knows, we may meet each other online or hopefully one day in person. Thank you very much.